Hello, hello, hello. So we're just doing, a quick video because, of course, what happened yesterday, with the bill being passed. And, a lot of people are very afraid of losing their health insurance. And, even though, Medicaid is an assisted program, it still pays bills. A lot of people are worried about, the bills that they are going to get. The hospitals that do take uh, Medicaid and other assistant programs, will they continue to take these assistant programs? Will the billers be affected? Will the billers be laid off? So of course, all those things, are going to play a part in the bill that was signed yesterday. As you guys know, I am Lisa, of course, and this is Sapphire Physician Coding. I narrowed it down to Sapphire Coding because I talk about a lot of things more than physician coding and not just medical insurance billing. Again, if you guys want to get in on those free classes, go ahead and get in. I have a few more classes left in medical insurance billing. You guys can get in on that. And again, once they demolish what they are trying to do, it will be a problem. And the most person who will have the problems are the facilities because these facilities that take Medicaid, like I said, almost 60% of their funds probably comes from Medicaid. So, I'm gonna put it like this. So if you have a facility with 1 million patients and they have Medicaid versus 2,000 patients and they have commercial insurance, you're going to get the most money from the Medicaid, even though it's $2 on a penny. You still are going to get this. I saw on the news this morning where a hospital announced that they were closing. I mean, I thought that was kind of fast, but once you do a foresee of what's going to go on with the hospitals and the facilities, the finance department already knows will they be able to make it without the patients that have Medicaid. Those patients that have Medicaid, trust me, it doesn't seem like Medicaid is the majority of the payer, but in many hospitals, Medicaid is the majority of the payer. Like I said, if you have 2 million patients and they have Medicaid versus 2,000 patients and they have commercial insurance, the Medicaid is going to oversee, even if it's $2 on a penny, because there's more patients, whether it's community, whether it's a rural area, those bills will still continue to be paid. No matter what you have to adjust off or write off, the claim is clean. Now, everybody's up in order. Everybody is trying to figure out what to do next. What does this actually mean for my facility? What does this mean for my facility? It means that you will lose money. It means that you may not be able to pay your biller. Billers and coders, you guys that are in my class, it means that the provider may have to go independent and hire his own biller. You understand what I'm saying? That facility may not be able to afford all 35 of y'all, but the doctor may decide, you know what, I'm going to open up my own practice. That's it. And I'm going to hire my own biller. That's where you guys are in my class, YouTube University and Sapphire Physician Coding. That's where you're going to come in at because they're going to look for people like you guys that are working independent. So, again, this thing is going to affect, like I said, parents, young mothers, primary care, annual visits. It's going to affect everything. And, not only Section 8. Like I said, if they did this thing many, many years ago and they said, okay, you have to work for this or you have to work for that, I don't see anything wrong with working for a benefit. But now when you have millions and millions of people already getting these benefits and you want to go snatch, now, Section 8 was already done in most states. Some states you have to have a case. You have to have a domestic violence case in order for you to even get Section 8. Some states they have Section 8 that open up periodically. You can jump in and you get it. They don't have ongoing Section 8. So some of that to me, was already into play. As far as the Medicaid is concerned, you're talking about people who are on Wegovy, people who are on Ozempic, people who are overweight. Yeah, Medicaid pays for that. Medicaid pays for that. Medicaid pays for Ozempic at 100%. So you're talking about they're trying to limit certain things. You know, I'm sitting here without the water, so we have a problem. They're trying to limit these things, and these things are already into play. I'm just trying to fix this. I don't know why it looks like that. Oh, there go the comments. Okay, so these things are already into play. So a lot of people worried about this. People who get care that's covered by Medicaid, of course, they are worried about this. And this is where revenue cycle management comes in. This is where the bosses come together. This is where we come together. Okay, we need to figure out this. We need to do the foresee before we lose completely. So, those of you who are already working in Medicaid, some of you are the Medicaid billers. Um, Tell me what y'all see out there. Tell me what's going on in your facility. Tell me how they are handling what happened yesterday. Um, I think a lot of people are definitely worried. And these are not just the people that, I don't want to say they just voted for Trump, they just voted for XYZ. Everybody is up in arms at this because the hospitals will soon start closing. You guys remember when a lot of hospitals started closing down and, the medical care was crazy. I mean, you're talking about we're going to have so much problems trying to fix this. Um, for this to go on for 3.6 years, even 2 or 3 months is too much. So I'm not sure what the plan is for the Democratic Party, but I think they need to go ahead and do something right now. It's almost like the choice for women, as far as the, I hate to say the word abortion rule that they made. Y'all know what it is. I forgot what you call it. But you're taking away a lot of things, not only from a woman's choice, from anybody's choice. I do think a woman should make her own choice as far as whether she wants to go to this clinic and have this done. Y'all know I can't even say it. She wants to go to this clinic and have this done, or whether she does it. Now you're saying that her Medicaid is also going to be a choice of the government. That's very hard to take because this benefit has been around for so many years and everybody has benefited from this. You guys who are coders, when we are doing the coding, you see different types of procedures, you see different type of diagnosis, you see different type of diagnosis codes. The coding that you're going to start doing now, you're going to start seeing a pattern in different areas, in different states, in different. I'm not going to say Republican and Democrats, but because it depends on what statistic is going on in that state. You as coders know. I'm gonna give you a demo. So if you're coding in Georgia and you're coding in South Georgia, and then you got the coders in North Georgia. What's the common codes that you guys are getting? If we are in New York and we are coding in Uptown Manhattan, and then we go to Long Island, Westbury, tell me the difference between the codes that you're getting. If you're in Brooklyn and you're over there in Bed-Stuy, okay, and then you're in Brooklyn and you're over there on Philander Boulevard. I forgot the name of that area, but you talk about two different areas. So you got one area where you're going to have statistics, maybe shootings, maybe critical care, and then you have one facility where you have heart attacks, where you have diabetic treatment, where you have cancer treatment. That's what goes on in that hospital. This is a trauma hospital, Jamaica Hospital. You see what I'm saying? Long Island Jewish, this is a hospital mostly where they have heart attacks, where there's older people, and Northwell. So, these things are all going to play a big part in people's lives, especially those that are older and elderly and that are retired. A lot of retired people, yes, they still have the benefits from their job, but they also have Medicare as a secondary, as far as an assisted program. And sometimes if Medicaid picks up the copays, Medicaid picks up them from having a balance. I mean, you're talking about people getting ready, balances is getting ready to get dropped. I don't know when this thing is going into effect. I do know that it will affect millions of people. And the problem with it is it's so fast. Boom. People who are on Section 8, they have children that needs to get their primary care, needs to get their shots, needs to XYZ. Some of them have children where they can't go out and do 8 hours to keep the Medicaid because they need the daycare so that they can pay for the daycare. They need to pay for the daycare so that they can go do these things. It's impossible. If she has a 6-month-old baby, how and that needs the Medicaid, how is she going to go out and do 8 hours when she doesn't have a babysitter? Because now you won't give her a stipend for the baby care. It's just almost crazy. Some of you who have businesses, some of you who are starting businesses, nobody's going to be perfect in starting a business. If you have an idea, go ahead and do it. I always tell my guys on Twitch, spread the word. Twitch is to me is a new way of you guys getting money. Twitch to me is a new way of rap. It is a new way of the younger generation to start their foundation. I don't care if you have a son that's 2 years old. I tell you, I saw the guy, his son was 2 years old, and he's teaching him how to do Twitch. He's teaching him money, growth, learn how to do Twitch, and I won't have to worry about you, even if you don't want to go to college. I think that is a good idea. If you can get on a microphone and you can attract people to listen to you, I think that you should do it. Um, YouTube and Twitch, I think, are two different platforms. I'm still learning YouTube. Forget about it. I did say that I was going to learn to Twitch myself, but I can't stay on Twitch for like 24 hours a day. Streaming. I can do stream when I am not at work. But again, do something to alleviate the horror of the insurance going away or the liabilities that you're going to be responsible for if you do go to a doctor's office because they're going to raise all kind of prices. They're going to raise fee schedules. The fee schedules are going to be out of control. The fee schedule is what we look at in regards to the prices for CMS for a lot of the procedures that are done in the facility. So that's a fee schedule. So the fee schedule does change every now and then, but just look for that fee schedule to definitely rise because if the Medicaid is going to be limited and the funds coming out is going to be limited, hospitals are going to have to change those fee schedules. You guys know me. I watch CNN all the time. I'm just trying to see how this thing will jump off with the insurance. Uh, these people who are on the GOP, a lot of people are paying for it. Yes, a lot of people have commercial insurance and they're paying the $300 deductible. Especially most of like the famous people, we know they can get it right off the bat. But then you have those people who are not famous who are getting this medicine. Well, I don't know what's going on in my head, y'all. Don't worry about it. Who is having Medicaid pay for this medicine to help them. Being overweight and obesity is a sickness. We can't help it. We eat, 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 eat. I'll tell you, I can't listen. The croissants at Walmart is ridiculous. The butter is crazy. I can't even eat just one. And to me, it's like a sickness when you get ready to go eat. So of course, your insurance, pays for it. United Healthcare Blue Cross Blue Shield pays for it, but you still have to pay a $300 copay. And you guys make sure you watch. I put a lot of clips of John Q. Man, let me tell you something. The people who made that movie is geniuses. And I want y'all to watch that movie because it will help you with insurances and it'll give you an insight on how a person feels when they don't have insurance. I'm going to probably put another clip up, but not right now. I just want y'all to kind of take in the clip that I gave y'all, especially in regards to the doctors and the providers. Those of you who are in my billing class, there's a section on provider incentives. And the provider incentive, they do get a bonus. They do get bonuses. Take a look at it. They do get bonuses. Whether they operate on somebody or not, a provider will get a bonus if he um, submits what he has done to the patient and if he has done it correctly. That's a portion of that in your medical insurance billing, course. But I would take a look at the John Q movie because it's a very good educational movie in regards to insurance. I haven't seen another movie in regards to the concept of John Q, and that's why I always put it up there. But you guys know I don't just talk about, like I said, the medical insurance billing code. We talk about everything. My thing is, you guys tell me, send me a message. What are you going to do? What are you going to do now? When will this thing take effect? They want people to work 8 hours a day or whatever they want as far as their Medicaid. They can't even clean up the Philadelphia streets with the people that are laying around on drugs. I can't even watch the video every time I look at it. Why it comes up on my screen, I don't know. But they can't even clean up their own streets. I just cannot believe that a bill like that was able to pass, and everything that's going on is being accepted. You know, the Democrats do have to do better. I think they need a new team. They need a new team. They've tried everything. They're talking, they're holding up, the this and that and that and this. They're going to need a new team to fight what they need to fight. Because imagine, did you guys see the thing about the young lady who was pregnant and they had to keep her alive until she had the baby? The baby was like 1 pound. I'm not even sure if the baby still lived. I hope the baby did still live. But I mean, can you imagine a corpse that is already passed on and the baby is in the womb? Can you imagine what kind of nutrients is this baby getting from the mother who has already passed on? And I mean, this was in Georgia. Let me tell you, ever since I've been in Georgia, I'm learning so much stuff about Georgia. It's like you should see my face sometimes when I hear things. But again, I would rather know these things than to be in the dark. And that's the reason why I made the Black Phoenix Team Us. Black Phoenix Team Us is a group of people who are educating each other. I don't know why that fan is still turning. I turned it off. It's not necessarily meaning black people teaching black people. It's only black people in my group. No, it's everybody. The Black Phoenix is the Black Phoenix. Okay, each one teach one. You know something? Let's teach each other. I do have the podcast, Lisa Real Talk, but some things I do want to put on this channel because it's basically about sapphire education. And my Real Talk channel, I will put that on some of the chapters that I do here. But the main thing for this video, even though you guys know it's the 4th of July, it doesn't matter to me. When I want to jump on, y'all know I'm jumping on. I was away, so I couldn't get to the 2 classes in. So I was in New York for a couple of weeks, so that didn't work. But I'm back now, so hopefully we can get back on track. And again, you guys see, I'm working on my studio, working on the studio. But every time I think about this thing with this bill that passed, and I haven't seen the whole bill. I did catch some of the reading of the bill, but some of the harshest things that's going to go down on that bill is that Medicaid being interrupted, compromised. Um, that's not going to work. We have pregnant women who need that assistance. You're 8 months pregnant. You can't do 4 and 5 hours work every day, and it ain't gonna be no office work that they gotta do. It's either gonna be they're gonna have to work in housing, cleaning up, or they're gonna work for sanitation. They can't do that. They can't do that. I mean, years ago, I know it was. I don't know if it was work for the tenant or work for the stamps. I don't know what it was, but they used to have to work for something. But for them to make this something that is across the board is totally ridiculous. Um, what are you going to do? That's the main thing. It's like, what are you going to do? Especially some people who only have Medicaid as their only source of assistance. Will they cut this out this week? Will they cut this out next week? When will they stop this? Uh, I don't think there's anything anyone can do. I did see something where President Obama and President Bush, I guess Bush decided to wake up and start intervening. I don't know, but I wish Bush would have jumped in earlier. because I just feel like it's way down the line now, but I do feel like Bush could have jumped in a little earlier. They may have something that they are working on. Uh, and I've also heard Musk um, knows something about something. If he comes to par and says how they actually won, they may be able to intervene. But I don't care. I don't think Musk, he intervened, but, the people voted for Trump. What are you going to do? The people voted for Trump. If you take away the people that Musk probably influenced, the people still voted for Trump. So, that's not going to be a factor. The thing about it is, what are we going to do now? Like I told you guys before, I think because he cannot abolish Obamacare, this is what he is going to do. But this is not the right thing to do. To me, you are destroying what is already abroad. If this was done years ago, and it would be the norm now. It would be the norm. Okay, you want to get social service, you want to get TANF, you need to work. Why work when you could just get a regular job? But if there's no regular jobs out there for you to get, how are you going to do it? You see what I'm saying? If you got a poll and you added 170,000 jobs, okay, you added 170,000 jobs, but you getting ready to take over millions of people off of Medicaid. You got 170,000 jobs. Wait a minute, you got a million people that need to get to work. So how is that going to work? I can't wait to see how this thing plays out because the motive behind it, what is it to get people working? People work still get Medicaid. I understand it. Yeah, I mean, people who work are still entitled to get Medicaid. Some of them just don't. I mean, I don't know what the cap is for it, but they still can get Medicaid as a secondary. The, the rules that they got right now, no more Medicaid. It's just impossible. I mean, you're talking about people who has relied on this for years. People who have relied on this to raise their children. Um, these parents, people, children, and young adults who are actually taking care of themselves, they need to have this assistance because this is the way they take care of themselves. They don't have to worry about, well, if I got to go to the doctor, at least I have, assistance to go to the doctor. The SNAP. How can you say that you're going to take away the SNAP from the children? I mean, bad enough they've already took away the lunch from people. I mean, it's almost as if a bad dream. And you guys know I don't do the black white thing, but the things that he has taken away, it makes you feel that way. It makes you feel that way. It makes you feel like, well, why is he doing this? It's not only those people who get this; they get it too. So you're not only abolishing these people, you're abolishing them. I don't know if that's the right word, but that's the word I'm using. Them, and them. So you guys let me know in the message. I mean, what would be the second choice if the Medicaid is abolished, if the Medicaid is gone? How will you survive? What will be your second thought in the moment? In the moment you say they've taken away this. So yesterday when the bill passed, I was waiting for it to come on at 8 o'clock in the morning, but I think Hakeem was still talking. And I'm not gonna lie, sometimes I feel like, why don't he just shut up and let them do it? He done gave them too much time now. The four that we did have, they done changed their mind. That's just my opinion. I think he just, what was the purpose? But you've got to figure out now who's going to pay for my Deborah. How do you say it, Deborah? Whatever it is, your shots. Who's going to pay for your shots? Now you have people out there that are worried about, I can't get my shot. I'm going to get pregnant. I can't pay for the care. I can't pay for the delivery. I can't pay for the meal. The WIC is gone. Now I don't know if WIC is. I don't know if WIC is included with the stamps. I'm not even sure. But I used to get WIC many years ago when I was pregnant with my daughter. I love the WIC. You can't tell me I ain't eating that cereal. Okay, y'all know Miss Lambert don't sugarcoat nothing. Um, they take that away, it's going to be a problem. We need those babies to come out healthy. We need these women to get those vitamins. This thing is going to affect all of that stuff. And I don't know if a lot of people actually understand how this will affect. I'm telling you, I can't even say how you say her name, Taji. When she came out on that podium, she told it. She told it. And it's almost as if there are more. I don't know if have you ever seen the statistics like this, whether there's more working people or non-working people, more people on commercial insurance than Medicaid. Have you ever seen a statistic like that on NBC? Because they only gear stuff towards people that have commercial insurance. What about the people that have the Medicaid assistance? It's almost as if, what are you going to do? This today is the 4th of July. Yeah, I know. Any day. Yeah, I know I'm on. Any day. This is the 4th of July. It is the independence of the 4th of July. How? When we were all just stripped of what we've always had for many, many years and helped us get off of the boat. Now, we know that it's a way, it's supposed to be an assistance to help you until you get this, to help you until you get that, to help you until you get. But that's not a reality when you got millions and millions of people on it. It's not a reality. So you can't just snatch it away. How about wean it away? How about wean it away and then you can kind of help them gain a different type of assistance or a different type of insurance? To me, I think a different type of assistance, or, okay, you want to take this from us, put us in this direction. You want to take this from us, put us in that direction. Don't just take it from the people and they're our cold. I mean, imagine an area where this is stricken. It's a stricken area and everybody has it. Okay? What is it? I don't want to use TB. I can use TB or whatever. Let's say you have this area and hundreds of people have this. Okay, you remember how I was doing like the hospitals, how the trauma hospitals, shootings, and then the heart attacks, cancer hospitals, and have different areas have different things. And that area in Philadelphia, they may have a bunch of people with TB in that area, and we can't treat them because the Medicaid has been cut. The Medicaid has been cut. If they've been on the street, or if some, y'all know what that happened when my hands started itching. If they're on the street and all of a sudden you want to tell this drug-stricken person, you got to work. I'm sorry. You got to figure out another way to do her, because she can't go to the facility now because you done took away the Medicaid. They ain't gonna pay for it. How's she gonna pay? You see what I'm saying? It is going to be chaos in the United States. I hear a lot of people say, "I hate the United States." I hate the United States. I don't hate the United States. And I heard the president say, "I hate the Democrats. They hate me. I hate them." It's not that the Democrats hates him. I think it's that they hate the things that he's doing. I'm not going to lie. Trump used to be my idol back in the days, especially during Apprentice. I watched that thing all the time, and I thought that this man, he's a businessman. That's it. That's it. I didn't know all this extra stuff, but being that it's already come about, what are you going to do? How can we make it better? Our younger generation, Twitch and all this other kind of stuff, I'm so proud of them. They're doing their thing. If you haven't started a business, or it seems to be you can get on internet and just start talking, and people just start watching you. I don't know. To me, have something that you're going to say that you could hope that people will be interested in, to talk about. Does it take a long time? Yes, it does. But you may be able to get your own insurance. Maybe from this day moving forward, we'll have to breed ours for that. I mean, my children are grown; they got their own insurance that they put. For other people, it's like, What are we going to do? Especially. I was talking to somebody the other day in a motor vehicle, and she's on a shot. I mean, she's working. I'm pretty sure she has commercial insurance. But the gist of it was, she was just talking to her doctor, and her doctor changed her GLP to something where she's got to pay a $400 copayment. And They told her to apply for assistance. How's she going to do that now? And she said she lost 80 pounds. I lost 60. I lost 60 pounds and put every bit of it back on when I stopped the shot. You guys remember when I stopped the shot? But I'm back on the shot now. I ain't taking it. I would take it on Sunday. I know. I'm sorry. I gave in and I went back on the shot. And I just thought I just paid the $300 copay. And I'm telling you, just think of it in a different way. I had to pay that doggone copay. I stopped because I had to pay the copay. What happened? I gained all the way back. I can't hardly pick my legs up. I'll tell you, I went out to the store today. I just was like, now imagine how other people feel when that Medicaid is gone. Medicaid pays for Ozempic 100. You guys remember when I went off Ozempic, I had to pay $300 copayment. And what happened? Look, I gained every 60 pounds back. When they tell you you get off of them with Wegovy, the GLP, and you're going to gain that weight back, I gained every single pound back. Now imagine if the Medicaid is restricted and all of these women, not everybody, but a lot of women in certain areas take it for their health. Maybe they have diabetes. And diabetes, you have to take it down. And Louis Crazy, Federal Blue sends like an email across. So I'm talking about my insurance right now, and it just says, "Shh." But anyway, I don't care where you work for, the federal government or whatever. We all pay a lot of deductibles and carry on. But again, what are you going to do in a split 2 minutes? And that's just like when something goes down or something happens. Look at my other video. Get your mind right. Get your mind right. Money means nothing if your mind ain't right. Your mind right, you know how to get that money. Your mind right, you know how to get out of a fix. Is your mind right so you can get out of this Medicaid era that they did? What are we going to do? Are you going to be afraid? Are you just not going to go to the hospital? Are you just not going to be fixed? Or will the hospital start turning us away? Will the hospital say, you have to pay cash? And when I say us, I'm talking about everybody. This affects everybody, everybody. Because you have family members that have this type of assistance. I had this type of assistance when I was a young mother. I had my kids, I was like 18. You understand what I'm saying? So listen, don't take anything for granted. Don't take anything for granted. It can't be a turnaround in less than 24 hours. I'm still cannot believe that some of the Republican Congress actually voted yay for this thing, knowing full well what's going to happen. I can't think of her name, but y'all know yesterday I was throwing her in there, and she came out of there. That woman looked like death was on her. I told y'all that woman looked like death. After she cast that vote, and she knew it was yay, and she knew it was wrong, she came out of there. She was white, and her eyes was like, I was like, she looks like she's seen a ghost. And whatever it is going to haunt her for a minute because she knew that she really didn't want to vote the way she did. And it's almost they're voting what the president wants out of uh, loyalty. But you're doing something out of loyalty and you are assisting murder. You're assisting a murder. Because these people who have these diseases and need this Medicaid assistance, you will see people die. You will see people die. You will see people who are trying to go and get assistance and the hospital is closed. And they probably can't even make it. You will have an ambulance come and get you, and guess what? You can't even make it to the next hospital. It's horrible. The smaller hospitals, especially some of these community hospitals, they thrive off of the Medicaid. A lot of the trauma hospitals in the smaller communities also thrive off the Medicaid. I'm not saying people don't have commercial. You have your Medicare. Medicaid also pays for home health care. You know, what do you want to do now? And I had a friend of mine. His dad. He was a sanitation worker. He got old. He got Alzheimer's disease, and they wouldn't even give him the Medicaid. His mother, again, she ended up having diabetes and also cancer. And then, you know, a day before she died, they finally approved the home health aid with the Medicaid. They would not give it to her. But this is just telling you what Medicaid actually pays for. You guys know the thing, like the family, the healthcare in the family, and then and let's say the daughter wants to take care of the mom and they're getting paid. That's part of state. That's part of state. That's part of state. Now we know that Medicaid is state and federal. Federal, you can't do right without the left. And so if you cut out all the federal benefits for the Medicaid, what you think gonna happen? It's unbelievable. Some of you who are getting Medicaid, let me know, how is it going to affect you? How I know this is driving me nuts. I don't know what happened. Let me know how it's going to affect you. You can send me a message. We can talk about it. Because the main thing is we help other people to understand, what's going on with insurances. The John Q movie, from the time that movie came on, hit it on the nose. I have another video in there on the John Q movie. I don't know how to spot those movies where you can see them, but I learned something the other day, and I think I'm going to do that so you guys can get the gist of that spot of that movie that I did, because I did do a chat regards to what went on in the John Q movie. When I finish this video, I'm going to do that. So now I think I'm gonna be in 3 days. So I'll still have time to do this. I'm still trying to work on how the stream thing goes. But I have another chat that has to do with the insurance. And one of the part in John Q is when they were going to the table, and it's a part of this one. It's actually a part of this one. Um, and Denzel said, "These people knew what was wrong with my son, and they never told me. They never diagnosed it. They just let him go on and on. Because you remember the child. I'm sorry. You remember the child that grabbed his chest? They knew there was something wrong with the child. They never said anything. As you can see, the parents were like, 'What's wrong with the child?'" And that's why I like that movie. Um, I'm gonna do the skit where you make it into a short. I won't do it now. I'm gonna leave that. Since you guys are enjoying that short, there's nothing to enjoy. It's just awareness. It's just awareness on that I actually did, and that's what a lot of my videos about. A lot of my videos will be, about awareness on this, awareness on that. You guys can see that board in back of me that says Sapphire Position Coding. I have a lot of videos out there, and those are two videos on my front that I normally put out there. And all of these videos are actually on chat. And I call it chat, but they're actually on videos in here. Most of them are video because I haven't too long ago started trying to figure out how to do the stream. Once I actually figure it out, we can see it. I just researched something in regards to why do I need to wear headphones. I have headphones over there on that table. I just didn't see the need to wear them, but now I do, because in some of my videos I could hear on my speaker where I am going in and out, where I might go down. So I'm gonna try to start wearing the headphones. I don't know, but again, and in doing the stream, I want to make sure that I get out there everything that I think is interesting for you guys to talk about. And insurance is the most thing that is interesting, because we all need insurance. We all need insurance. When you go to a doctor and you can't pay, they can't turn you away. They can't turn you away, but they will bill you. Um, and I'm telling you right now, many years ago, we had a patient. The patient had Medicaid. Patient had Medicaid, but the patient came in. It was a child, and they needed an emergency service. Um, the deal was they sent these people to me because there was a lien on their house for the bills that they received from the hospital. My job was to find out what happened from the day that child came into that hospital to the day she was discharged. Who took in the intake? Who took the insurance? What insurance she had? Tell me which biller you worked with. Tell me who was the one who did the work. This is I don't even know if they still have IDX, but this is back when we used to have IDX. And I mean, they bring these people to me back to my office through faculty practice, through the billing. Nobody's allowed to come back there. That's a money office. And and everybody's looking like, Miss Lambert, do you know they bringing you parents back there? I'm like, well, why would they be bringing parents back here? That's how crucial it was. The facility um, had a lien on these people's house because of the amount of money they owe the hospital. Now, once this thing actually goes to collections, once it goes out of our hands, we pretty much write it off. It goes to collections. But that doesn't mean that we can't pull it back. Just like a collection agency. If a collection agency takes something from the third party collection agency takes something from the original creditors, the original creditors can actually take it back. They just don't because they don't want to be bothered with it. Because this thing is already in collections, it's already in outtake. I have to do a lot more digging. I have to do a lot more digging, and I have to find out who's got this paper trail. I have to find out, did these people have this Medicaid when the services took place? Now, when you have Medicaid and you've already had a service done, and let's say you apply for Medicaid 2 months later, Medicaid will backtrack that and pay for that. In this case, the girl, the women, they already had the Medicaid for the child. Um, so the gist of it was they were getting their house. Their house was going to be taken away. Oh, they owed over $200,000 in bills to a hospital. If you don't have insurance, we don't have to write off anything. There's no contract. We don't have a personal contract with them. Okay, we have contracts with commercial insurance, Medicaid, Medicare, things like that. But if you are self-pay, I'm not writing off nothing. We're billing you straight up, unless you've seen a financial counselor and we did some type of arrangement for you prior to you having that surgery. If there was nothing and you had no insurance and you came in and we did your surgery, because we can't turn you away, we're billing you, and we're billing you at 100%. Okay, that fee schedule just a whole different fee schedule. Self-paced fee schedule. We're billing you at 100%, and there's no adjustments. There's no write-offs. So that's pretty much what happened to this patient uh, child. Okay, they are the responsible party. They are the ones who will be responsible for the payment to the hospital. Um, so what I found out was they did have the Medicaid. The Medicaid was never billed. If you have a primary insurance, it does not cover something the Medicaid is supposed to kick in. Totally different from drugs. Totally different from drugs. Okay, they have to show the denials and XYZ, and it has to be submitted. So in this case, in turn, the patient came in on an emergency visit. An emergency visit, we got 48 hours to clear that claim. When I say clear that claim, we got 48 hours to get authorization. We got 48 hours to submit to that insurance company what's going on with this patient. We got 48 hours to submit to this company the codes that's going to happen to this patient. They either approve, authorize, or they don't. If it's not approved, then it has to be appealed. As long as the authorization request was submitted, you can fight. If you don't submit the authorization request within that 48 hours, we might not have a leg to stand on. They might deny it. Okay. And if there's no authorization, we have to write it off. Patient is not responsible. It's not responsible. Okay. It is our job to find out what this patient needs especially when it comes into emergency. We can get as much as we can out of a parent, but you better make sure you're going on that insurance and finding out what's going on with that policy. So you see how important it is to make sure you have insurance, and you see how important it is to have Medicaid. Um, I'm not sure if he is demolishing the Medicaid because of the immigrants that are coming in and the people who have Medicaid, but we have to have Medicaid for people who are coming into this country. They don't have insurance. What is he? I just don't understand it. Whether they are here illegally or not, they still need to have coverage. They still need to have coverage. If you have Medicaid, that's available, and they're entitled to it. They don't have billions of dollars to pay insurance claims. Medicaid is state, Medicaid is federal. You want to cut out all the federal? Cut out all the federal. Then they need to lower fee scales was half, half. Because I don't know how they would make it. So you guys tell me, uh, what do you guys think is the next step? Do you think the next step is, all right, I better get out and go to work? I might as well just pay my own policy premium, or you're going to hold out and wait to fight, um, or have everybody already done their primary care for this month already? Um, and not to mention the breast exams and mammogram and all these other things. Come on, y'all. If he cuts that thing out completely, we have a problem. Even if the Fed portion is gone, it's still a problem. It's still a problem. One of my girlfriends the other day, bless her soul, her mom passed, and she was doing the health care for her mom. And now that money is gone. That money is gone. Medicaid was paying that. That's state money. It's state money. So it's not only the assistance that's going to turn away, it's going to turn away for a lot of other things because federal government helps the Medicaid. Okay. Um, I can't say whether I agree or disagree. I do agree with um, being more independent. I do agree with working for your stay. I do agree with paying your way. And yes, you can get used to those benefits when you've had them for so long and 20 years pass and you still have them and you still haven't even got out and went to work. You comfortable with the government paying your rent, the government paying your insurance, the government feeding you. You can get used to that. That's one of the hardest things that I've seen in the PJs or people with Section 8. Sometimes you get used to that. Um, that's just like when you live with somebody else. When you get used to that, you kind of get used to that. Whether it's wrong or right, that's up to you. It's wrong. It's wrong. You need to get out and get your own. Don't stay there just because it's comfortable. It's almost the same thing when you have housing. When you're in housing, it's supposed to be so-called temporary. But I don't know how housing can be temporary when you have people who have lived in housing for 20 and 30 years. Because you got them in housing. Okay, now let's start training them. Let's do some training classes, and we can show y'all how to get this apartment after we get you a job. Let's get you a job, and then we'll do X, Y, Z. And I'm not even going to say that because you can have a job when you're in housing. What do you pay, like 15% rent or something like that? You can work and still be in housing, but instead of paying $95 a month, you pay the max $500 a month. But you work. But you know what I'm saying? Even if you didn't work, you still would be allowed to be there, but your rent will be minimal. You see what I'm saying? And your rent that you're paying will be part of the social service that you're getting. So it would still be the government paying. You see what I'm saying? And um, It's not necessarily all the government. The state picks up a lot of this. We was talking about something the other day as far as sanctuary states, XYZ, like Connecticut. They pick up a lot of stuff in Connecticut. When Connecticut come on, you think Connecticut is in a world by itself. Right. I just don't see it. They have the same issues like everybody else. They have the same issues. But I do think the homelessness, and people who actually need the assistance from the government should get the assistance from the government. Everybody, it's not peaches and cream. I mean, you've had people who've had Medicaid all their lives, and now all of a sudden they can't go and get this medication. And you guys hear people talking about that when they go get uh, if they're on Medicare and they got to pay all these different type of co-pays and everything. It's hard. Life is hard. Life is not easy at all, especially when you are trying to do you. You're trying to buy your food. You're trying to work. You're a single parent, even if it's a guy. Guys are single parents too, and you don't have any child care. There's no milk. There's no Pampers. What are you going to do? What I hope we don't start seeing is people like abandoning their children. They had something on what's the name the other day where the girl put the boy in the shopping cart. She just walked off and just left him right there. How can you do that? Uh, I don't even think I watched the whole thing. Stuff like that, I can't even watch. I mean, she put the child in the shopping cart and she walked off and never came back to this child. And imagine things like that might happen because of what's going on today. People might feel like, I can't pay for health care. I can't XYZ. I can't go for a job because I don't have daycare. They won't pay for the daycare. They give the vouchers for daycare. So, like I said, I haven't read the whole thing, but in my understanding, they plan on taking that away too. Um, I think it's disgusting. I think it's disgusting. And you guys remember when I said, I'm going to get involved some type of way. I did my voter registration for this state the other day, but we'll find out, which way that's going to go because it's got to be more to it than the Democrats. Just they're just making way. Like I said, I think the Democrats need fresh faces. I think Democrats need new people. But I think we have to find a way to come to a better conclusion than the bill that they just signed off. And what bugs me out is they're signing all these different type of bills and things when he's only going to be president for 3.5 years. They're talking like he's still going to be the president. And I saw something about the Obama thing. Okay, like you said, if that is the case, then Obama should be able to get back in there. Um, because I think most definitely the president is fearing. Of course, you're going to lose. You're not going to win against anybody for another term. I don't care what you say. All of these people who voted for them, trust me, them people are not voting for him in 3.5 years. Okay. And like I said, I think they got something up their sleeve where they don't care about the Constitution. So, and what's crazy is they're not abiding by the Constitution and nobody's doing anything about it. I mean, it's ridiculous. I never seen anything like that before. I mean, we have laws and we have rules, but I had no idea that the president had that kind of power where nobody can touch him. You can't do things like that. But again, this is about insurance, being uninsured, working. Find a job 4 hours a day, 5 hours, 6 hours a day. Learn how to do Twitch. When I heard them say that you only need to do like, what do you need? You just need 2,000 hours and you get XYZ. I'm gonna figure it out because next thing you know, y'all gonna see me on Twitch. I'm telling you right now. Because something has got to give. Our young people, this is all young people. I don't care what color you are. You got to find something to come up out of this. because I think it's only going to get worse. The discussion about Elon, I don't know what type of part he can play, but he appears to be the only one that will go up against Trump. No one else. No one else is going up against Trump. Congress is gone. It's they sold their soul. They are gone. When you think something is for the right, it's more evil. I'm not gonna say the word I really want to say. Y'all know what I really want to say, but I can't say it. It's more evil in Congress than you have ever seen before. And you see all of this stuff on Front Street. The police have been given the right to snatch up whoever they want to. I was just outside. I went to the store. I'm in the parking lot, and I'm seeing. And there were three police cars, and the back of there, I don't know what it said, USPLA. I don't know what it said, but they pulled somebody over. They yanked him out of that car and locked him up. And I said, "Well, God, they've been given the key for destruction." And maybe because it is the holiday, but let me tell you something. Be precarious of what is getting ready to go down. If you do not have insurance, call your social worker so that you can find out what you need to do. Even if you do have to do 4 hours a day, it's not going to be in an office. It's not going to be, it's going to be in a building somewhere. Don't quote me to that. I just, that work related what do you call work related, it's just like a work furlough type of thing. You'll be picking up garbage and you're going to be something, and they know that in Congress. They're talking about working for your Medicaid, working for so and so. Now there are some instances where they take people and they do work for sanitation and housing, and they actually hire them on. They actually hire them on. But you're talking about thousands and thousands of people who's getting ready to lose all of their coverage. Um, you guys let me know. If you guys know more about that bill, let me know. I'm gonna go online. Let me see if I can find it. I ain't reading 100 pages of it, but I would like to see some more of the stuff that's in there that pertains to the people. And I think the whole thing is pertaining to the people. Um, if you're about to go without insurance, if you are on Ozempic and Medicaid is paying for your drug, call me. See what happened. See if they sent you some type of letter. Today is a holiday. The decision was just made yesterday, so we don't know XYZ, but they should be abreast on this already. You always have a before and an after. If this happens, this is what we're going to do. So they've got a plan already. They should have a plan already. When I say they, I'm talking about your state social service, your state, uh, well, depending on if you're either a red state or a blue state, they got something going on to assist you guys in what you need. Um, because if you're going to work 4 hours, that's not going to give you insurance. That's not going to give you insurance. I think it's totally ridiculous. But I think it will take them some time to actually get this thing together, and it most definitely will be not within. I don't think it will be within his term. But like I said, I think that he plans on staying a much longer term. Um, but if you're getting care and this thing that's going on with the Medicaid is going to affect that, what are you going to do? What are you going to do? Let us know. If you have Section 8 and this thing is going to affect you, what have they told you? What has Section 8 said? Have they sent you something from Section 8? Have they sent you something from social service? Because more than likely, if some of you are getting Section 8 and you're on social service. Social service is probably picking up that balance. If you're working, then you're picking up the balance from Section 8. So and it's probably like $100 or $200 or something like that, or it could be more. I don't know what the max is. I guess it's depending on what the rent actually is. But again, what are you going to do? What are you going to do if they cut these things out? I'm hoping that between Bush and Obama, they can come together and they can find some attorneys that will find a loophole and getting him out of office, getting him away from being the president. Not because we hate him or we don't want him to be the president, because he's making decisions that's destroying the United States. I'm not saying, I disagree with every single thing he do. I don't disagree with everything that he's doing, but the things that are mainly hurting the people, those are the things that, it's heartfelt. And you could just see the faces on the people. What are they going to do? Okay, so I'm already an hour, and you guys know I try to go an hour. Don't miss the Sapphire Physician Coding class. I will release that tomorrow. I might not do that live. I might do that video this afternoon and go ahead and put it out there for tomorrow. There's also the bookstore that's also in there. You can get the books from. You guys check out the YouTube. Check out the book that I have on there. That's an ebook. If you want to know about medical billing and coding, okay. You want to learn about insurance? Go take a look at my ebook. It's in here. It's going to say ebook finally posted. Take a look at that John Q movie. That's the best movie that you're going to get. That's going to give you almost real life interactions. You're going to see that girl have that accident. You're going to see that she is an organ donor. It is amazing. Watch that movie. I'm gone. I'll see you guys next time. I'm pretty sure I'll have a lot more to talk about, but you guys make sure you look at this video. Okay? I'll see you guys next time. Thank you for watching. Please subscribe.